High blood pressure, it's this silent, relentless force that affects millions of people. But for decades, doctors have had this incredibly powerful ally in their corner. Today, we're going to do a deep dive into one of the most effective medications ever developed to fight it, a real pressure protector called chlorthalidone. And this, right here, is the central mystery that makes this drug so fascinating. I mean, how can one single tiny pill manage one of your body's most critical systems, not just for a few hours, but for more than 2 whole days? It sounds like something out of science fiction, but it's a reality for millions of people every single day. And make no mistake, chlorthalidone is an absolute heavyweight champion in cardiovascular medicine. It's not just some simple water pill. It's a precision tool with a long, proven history of saving lives. So let's peel back the layers and really get into the elegant science behind how it keeps your pressure protected. Okay, so what is this blood pressure powerhouse exactly? Let's kick things off with a clear, simple definition. So at its core, chlorthalidone is what's called a thiazide-like diuretic. Now, the diuretic part is easy to understand. It just helps your body get rid of extra salt and water. But that phrase, thiazide-like, is really key. It tells you that while it's in a common family of drugs, its unique structure gives it some serious advantages. And listen, this isn't some new, unproven drug on the block. We're talking about a cornerstone therapy that's been trusted for decades. Time and time again, huge clinical studies have proven that it does its job incredibly well, and I mean significantly reducing the risk of things like heart attacks and strokes. All right, now for the really cool part, how does it actually do all this? Well, it's not just one simple action. It's more like a brilliant two-phase mission that unfolds right inside your body. So chlorthalidone's game plan is 2 big steps. First step is what we can call the initial flush. The drug goes to your kidneys and basically blocks these little salt recycling gates. This forces more salt and the water that always tags along with it out of your body. That immediately lowers the amount of fluid in your system and brings the pressure down. But wait, that's not the whole story. The real magic is in phase 2, the long-term relaxation. Over a few weeks, it actually helps the muscles in your artery walls to chill out and relax, widening the vessels. This gives your blood more room to flow, and that leads to a steady, sustained drop in pressure. So why does it last so incredibly long? Well, the answer is just ingenious. The drug molecules basically hitch a ride on your red blood cells. They latch onto them, creating this massive, slow-release reservoir that's constantly circulating through your body, gradually letting go of the medication over time. Just look at that number. Over 48 hours of continuous blood pressure control from one pill. This super steady, round-the-clock action means you avoid the dangerous peaks and valleys you might get with shorter-acting drugs. And that's a huge reason why it's so effective at preventing those major cardiovascular events. Now, because of this powerful and super long-lasting mechanism, chlorthalidone gets used for a lot more than just high blood pressure. Let's take a look at its key clinical uses and advantages. Okay, obviously hypertension is its main gig, but it's also a go-to drug for managing edema, that's serious fluid retention, that can be caused by some really tough conditions like heart failure or liver disease. And here's a fascinating little side use. Because it helps the body hold on to calcium, it can even be used off-label to help prevent certain kinds of kidney stones. Pretty cool, right? Now, to really get why it's so important, you have to see it side by side with its more common cousin, HCTZ. And wow, the difference is just stark. Look at the duration. Chlorthalidone absolutely dwarfs HCTZ. But here's the real kicker. The clinical evidence showing it reduces major cardiovascular events is significantly stronger. This is exactly why a lot of clinical guidelines are now saying this should be the preferred choice. Of course, with any medication this powerful, you have to be careful. So now we've got to talk about the important fine print, the potential side effects and drug interactions. Most of the side effects make perfect sense when you think about how the drug works. Since it's flushing out salt and water, sometimes it can flush out a little too much potassium or sodium. That's a big thing to watch for. It can also mess with your metabolism a bit, raising blood sugar or uric acid levels, which can be a problem for people prone to gout. And then, of course, things like dizziness from the lower blood pressure and, yes, needing to urinate more are pretty common. It's also absolutely crucial to know what other drugs it doesn't play well with. For example, it can cause a dangerous buildup of lithium. And that low potassium it can cause, that makes the heart medication digoxin much more toxic. Even something as common as an over-the-counter NSAID, like ibuprofen, can make it less effective. So when you put all of this together, you see a picture of a really potent medication. And that brings us to our final thoughts. This is a tool that truly, truly demands respect. And all of this leads to one critical takeaway. Because it's so strong and can really affect your body's electrolytes, anyone taking chlorthalidone needs to be monitored regularly. Simple blood tests are absolutely essential for checking things like potassium levels and kidney function to make sure the drug is working both safely and effectively. You know, this quote really says it all. Chlorthalidone is a remarkable pressure protector, and it's a testament to incredibly smart pharmacology. It is a highly effective weapon against a massive public health threat, but its very power is the reason it has to be used with so much care and precision. It's a great reminder that in medicine, sometimes the most established tools aren't just reliable, they're powerful enough to demand our full respect.